And I am, in my comments, going to try to keep brief my discussions about motivations for modeling, because from the bootcamp tree surveys, I think many of you have probably a fairly good grounding on this, but I'll try to stake a particular stance with respect to the role of modeling and the advantages it offers, particularly in terms of learning. That's a little bit different for many modelers. And I want to make sure that this is conveyed to you because it will have manifold implications throughout the bootcamp. And it may, help you better understand some of my comments when it comes to agent-based modeling. So everyone here online in the room will be familiar with the fact that we as a society and as a global community are confronting, yes, Larissa. Sure. Yes, thank you. What would I do without Larissa? She's just awesome. So everyone will be aware that we're facing, problems, challenges to humanity of growing complexity and texture. And these span diverse areas. I've listed a few of them here, but all of them share this general feature of complexity. And when I use the term complexity here, I'm not using it in a casual sense, but a technical sense, in a sense of referring to situations where we're dealing with systems where the whole is greater than the sum of the parts. They're often entangled systems where what goes on in one place ends up having pervasive and promiscuous implications elsewhere. Poking the system in one place leads to unexpected changes at other places. And where the behavior is often hard to anticipate and hard to manage or constrain, hard to control. And within these systems characterized by this complexity, we have challenges managing them because of the long delays between when we act and when we see responses, between the complexity or the diversity of implications of a given intervention and the unexpected character of those interventions. And almost invariably, these are nonlinear systems. And so if we're considering multiple attempts, different types of strategies for controlling them, and we want to understand the implications of several such attempts as a portfolio together, they're often very, very different than the effects in isolation. And systems like this have been described for the better part of a century, beginning with infectious disease modeling, as characterized by a variety of factors. And different areas of system science will emphasize difference of these factors, some in the nonlinearity areas, in the presence of emergence, this surprising behavior that emerges from the model that's different from any one of its pieces. As different as as in the way in which a traffic jam, the phenomenon of a traffic jam is just profoundly different from the pieces that make it up, from the individual cars. You can know all the world about car types and axles and engine sizes and number of cylinders and tire types, and it wouldn't tell you a whit of insight. It wouldn't give you a whit of insight about traffic jams. They're an emergent phenomenon. They're at a higher level and not merely reductive to the individual pieces that make them up. So it is when we're dealing with emergent systems in general. Systems like this are characterized by feedbacks and path dependence. History dependence is another term that's used, whereby a factor that occurred early on, say an early life insult with a child, adverse childhood experiences, could lead to profound ramifications late in life with chronic diseases, behavioral challenges, et cetera. And often we see network effects, adaptation and learning, et cetera. And there's many spheres where this is applied, and our own work has crossed many different domains. One of them is emergency department waits, where long waiting times in emergency departments are a problem that manifests in emergency department, but can be traced to many different areas of the healthcare system. It manifests most acutely in emergency departments, but in order to understand it, you have to look at the hospital wards. You have to look at what's going on in the community. You have to look at discharge policies. You have to look at all these different areas across the entire health system. And so it is with, for example, opioids, the opioid epidemic, where, what we see in emergency rooms in terms of overdoses needs to be understood in the context of drivers and phenomena in chronic pain management, in postoperative management, in recreational drug use among teens, and availability of drugs on the street, which are excess drugs from chronic pain patients. Needs to be understood in the form of intergenerational trauma and other factors. Antimicrobial resistance is yet another area where a sphere where we thought we could readily control the risks of infection in patients with wounds or who are being challenged through surgery or other types of surgical involvement, and yet we found that over time, our ability to really safely treat individuals is being hampered by reactions to our own interventions. When we roll out new antibiotics, it's only a matter of time before antibiotic resistance rises in response to them. We undertake actions, but then we get blowback from a system that learns and reacts and adapts in ways that puts pressure on our ability to formulate safe means of treating patients these days post-surgical. The food system is yet another area of dizzying complexity, where what goes on in one place ends up rippling through to affect food availability and food safety in many other areas. Just going to get the chat window open. Okay, so sometimes when we're operating in these spheres, we feel a little bit like blind men and the elephant. The ancient parable of different individuals groping different parts of the elephant, each thinking that they understood the whole of the elephant from the tail or from the tusk or from the left ear and right ear, and of course arguing vociferously about the nature of the elephant, whereas the elephant itself transcends all of those. It's something more than any one piece. And if our goal is to stop an elephant from rampaging crops, we need to reason about the elephant as a whole. Now, these challenges become particularly acute in two areas. When we're trying to explain what's going on from phenomena in the world, we see associations from the world. We undertake studies looking at patterns of opioid overdoses across Canadian provinces and municipalities, and look at it in its relationship with, for example, prescribing patterns or availability of harm reduction efforts. And we want to understand what's driving these patterns, what's leading to the vulnerability to overdoses. We would like to know, does evidence, support a hypothesis that we have? Where's the situation likely to go next? Is it going to worsen? Have we shifted to a mode in terms of the opioid crisis during the pandemic, which is going to take years or decades to play out? Have we shifted to a permanently worsened set of outcomes, or will it come back to its earlier, less dramatically worsened state, but still troubling state? What's driving these patterns? And sometimes even figuring out is a pattern good or bad is hard. During the pandemic, we've of course been faced daily with growing amounts of data from clinical indicators, from wastewater, from social media that tell us something about the environment out there as it relates to COVID. But it's really, those pieces in isolation are not telling us that much any more than the pieces of the elephant are telling us, about what we need to take action. We have to instead relate them to each other, understand what they're telling us about each other. For example, understanding COVID-19 cases, we really need to know something about test volumes that we're undertaking that may give rise to those cases. If we're undertaking lots of active testing, lots of effort in terms of contact tracing, and lots of effort in terms of drive-through screening, finding more cases could actually be a good indication, because we're finding people who are infected who otherwise wouldn't be found. In other cases, it could be a sign of a crisis in the making. Now, in infectious diseases, some of the earliest investigators in the 20th century identified, some of the hallmarks of these complexity, like in the form of the semi-periodic oscillations in childhood infectious diseases, shown here from England and Wales and from Saskatchewan on the right. More recently, authors have found huge disparities, for example, in communicable disease rates across geographies. And much of the challenge traditionally in interpreting this data has to do, often we have some theory about processes in the world, some beliefs that we suspect are grounded about what's going on out there in the world to explain these patterns. But we have some empirical observations. And if we're only informally reasoning about what sort of implications our theory would give rise to, if that's all in our head and we're just trying to play out in our head, we think this is what's going on in the world, that's our current hypothesis about what's happening in the world, it's hard for us to compare that against empirical data with confidence. It's hard for us to say the empirical data falsifies it. It's hard for us to say the degree to which it strongly supports it, because it's not clear what the implications are of our theory over time or over space or over networks that we measure. An even bigger challenge comes up when we need to intervene. All these things I've just talked about in interpreting the world still remain there as challenges, but we have additional challenges as well. And often, of course, in public health, our goal is to intervene. It's to bend the curve. It's to improve the situation. It's to lower the burden. And when we seek to formulate interventions that work, fixes that we want to put in place that stay fixed, to use the words of Jeff McDonald, we have a set of challenges we have to face. How to intervene, where to best intervene in the system, how soon will I see effects? We don't want to declare an intervention dead before it's had time to play out its natural effects. How can we best scale up, et cetera? And in something like the food system, this can be very, very challenging to reason about. Just where, am I going to intervene in order to allow greater access to nutritional food, for example, for lower income neighborhoods? Is it in health, subsidies for these, putting taxes on sugar sweetened beverages? Is it working with WIC and, Women's Infant and Children Program in California to provide healthy cooking classes, providing tax incentives for supermarkets and underserved areas and food deserts, fostering better transit access to supermarkets as they exist and easier travel back and forth for lower income neighborhoods? Is it subsidies for nonprofits so they can provide refrigerated food storage? These are challenges that cut across those areas. ED weights and patient flow, similar challenges. Antibiotics, similar challenges. Dealing with the opioid crisis, similar challenges. Where do we invest resources for action? It's often not so clear. And one of the biggest challenges here is not only do we have this challenge of understanding the degree to which we're trying to understand, do observations from the world line up with my theory, but we're trying to make a difference. So we have this theory about what's going on in the world. We have these interventions that we're considering, and we'd like to put those together and understand to what degree do they lead to desired outcomes. We want to choose packages of interventions that will lead to desired incomes that are sustainable and large, high leverage, and hopefully, come quicker, et cetera. And if we're pursuing this with informal reasoning, we've got a devil of a challenge. It's in some cases, it's a fool's errand. If we're dealing with complexity like we have in the food system, or like we have in the opioid crisis, or antibiotics crisis, or the ED weights and patient flow, trying to put these things together in our head, our theory of how things work in the world, together with our understanding of possible intervention strategies, trying to figure out in our head which of those is likely to yield the biggest results is profoundly difficult. And as a result, again and again and again, those seeking to make decisions in an unassisted way, are faced with challenges, misperceptions of a system, policy resistance, cases where a system pushes back or dilutes the effects of an intervention, or where that intervention actually achieves worse outcomes. We also have challenges learning from experience, coordinating, planning effectively, designing a system that's more equitable. And, sometimes the issue is not merely a lack of resources. Sometimes it's the resources aren't coordinated. So we end up going in circles because we've resourced some areas too much. Maybe this is acute care, for example, in the case of ED weights. We pour resources into the hospitals and so on, very starving resources in the community. And we end up going around in circles because people can't get care in the community and end up going to emergency room for care. They end up not being able to be discharged quickly from the hospital wards to the community because the services aren't there to provide them safely. The home care isn't there. The rehab facilities aren't there. The long-term care facilities can't take them. And we get backups and we go around in circles because of that. We get backups that start in the hospital wards and propagate down to the emergency room until the emergency room can't place people in the hospital wards because the wards are full because the community services aren't there. So, if we have a mismatch in our resourcing, if they are discoordinated, if we disproportionately favor one area or the other, we may end up being also in a pickle just as much as we didn't have resources in the first place. And we end up often undertaking actions that come around and smack us in the head. And this again cuts across areas. So to address many of these challenges, those in the room will be familiar that in recent decades, there's been a growing awareness of the potential for bringing systems science lenses to these challenges. These sciences, which really were important intellectual steps within the natural sciences, but also took place early in the 20th century with revolutions in understanding communicable disease spread in the work of Kermick, McKendrick, Ross, and others. And I like to refer to these sciences as system science or complexity science, and I use those terms just about interchangeably. You can quibble about the degree to which they're totally synonyms, but I'd like to refer to them as the science of the whole. They're about the whole elephant. They're not about the pieces. They're about understanding the elephant as an entire creature and reasoning about it and working to tame that elephant. System science as a enterprise aims to help us visualize, understand, reason about, and often help manage implications of systems, of these complex systems, and to test the consistency of our thinking with evidence. And one of the primary ways we pursue this is with dynamic models. Those of you who have taken my classes on data science and system science jointly, or were part of my data and system science boot camp, will recognize that within that boot camp, I talk about other areas of system science beyond dynamic modeling. For example, spoken about state space methods, convergent cross mapping, et cetera, that are not model-based approaches. They're based on complexity theory, but they're not model-based approaches. But one of the foremost ways, and certainly the most prominent way in which system science has sought to tame the challenges of the rampaging complexity is through dynamic models. And it's because models provide us this incredibly powerful mechanism of weaving together representations of our hypotheses about how the system behaves. Think back to that first model we saw, right? Those hypotheses as they were articulated as stock and flow diagrams about how weight changes in response to energy intake and energy expenditure from basal energy expenditure and physical activity, or imagine that hypothesis about how people make decisions about what to eat. Models allow us to represent our hypotheses, and then by representing how things might work, we could see the logical implications of that. And as such, they serve as thinking tools. I'd like to view simulation models as dynamic hypotheses. There are times where we build models, and we'll see some in this boot camp, where they're actually not hypotheses about what's going on there in toto in the world. They're hypotheses for the sake of theory building, alternative hypotheses that we don't believe necessarily apply in the world, but help us think through implications if it were a certain way. But often they are depictions of kind of a simplified view of what's going on out there in the world. And we build these models often to help us think through the consequences of our hypotheses, and to test the consistency of those hypotheses against empirical data. We do so not because the model depicts reality. It's not that the model is true, typically, that they are valuable. It's because they more quickly find out when our thinking is off base. It's by falsifying the model that we advance our thinking. A model doesn't give us the truth, it speeds us towards the truth by helping us more quickly find when our cherished understanding or beliefs about the world just don't add up to be consistent with that evidence. You may recall that early model we looked at today. We ran it and we saw some curves, some associations. If those associations were at stark variance with what we observed from the world, it would tell us that our hypotheses, as we've depicted in our model, need adjustment. The model here is not a depiction of truth. It is a faster way to test the consistency of our thinking with what's going on in the world. Now, these models serve many uses. Once we've built them, they can be allowed to ask about counterfactuals. We can ask what-if questions. We can evaluate the benefits of restructuring a system once we've developed confidence in a model. We can use it to understand trends and make sense why we see these oscillations or why we see this devastating rise in the number of overdoses and what's the primary driver for that. We can prioritize data collection based on the sensitivity of our model to certain assumptions and put more effort into the assumptions that are to which it's very sensitive in its outcomes. We can understand classes of context in which certain intervention strategies may hold water. So dynamic models here have a relationship of data that's oft misunderstood. I remember encountering a fellow health scientist one time who cautioned a group that we need to avoid. We need to recognize that models are not enough. We also need data, and I'd say we need both together, in big ways. And one of the biggest values from models is their ability to help make sense of data, to use data and render it like Rumpelstiltskin from straw into gold, into high-level insight. So models help us learn more quickly, more effectively, more robustly, more deeply from data, because it allows us to test the degree to which our cherished hypotheses really add up to be consistent with the data. The analogy I'd like to use here, and it's one that will last through the boot camp and beyond, is that models are like maps. And this may sound strange, but bear me out with this. So the idea here is, look, we've all used maps to navigate. Some of you use maps to navigate to this very room this morning in the form of Apple Maps or Google Maps. Some of us are old enough to remember navigating in cars with paper maps. These maps are useful because they represent abstractions of the features of the world. You want to navigate with a map that shows you the essentials of how to go, what streets you need to go on to get here this morning, what paths you need to walk on, or what subway lines you need to ride in order to get to your destination. It's their capacity to omit details, that the fact they don't show every tree or every blade of grass or every sewer grate, that makes these models useful. But they're specific to purpose. And this is a key point that's, again, going to come back again and again and again. And it's going to be particularly germane for agent-based modeling. Maps are specific to purpose. If you think about it, if we want to, take transit across Toronto, we'll use a very different map than if we want to bike across Toronto. Very different map than if we want to drive across Toronto, and a very different map yet than if we're an electrical engineer and we want to figure out why there are brownouts in certain areas of Toronto or why there's flooding in other areas. For each of those, we use totally different maps. They all depict simplifications of the situation in Toronto at some level, but what details they omit and what details they put in are different by purpose for which they are being aimed. And you could argue that each of them is wrong in the sense that they are a great simplification, they are a great variance from the actual situation. But it's their very incompleteness and their fitness for use that is what allows them to confer value. They confer value because they capture the essential details for your challenge, your type of problem. This is a key point we're going to return to with agent-based modeling, because with agent-based modeling, in my view, the single biggest danger, the single biggest challenge, the single biggest practical barrier to benefit of agent-based modeling has to do with how flexible the technique is to put in more detail. And one needs to restrain one's exuberance for putting in too much detail with a recognition that often learning less is more, and proceeding in a methodical step-by-step fashion is advised. Okay, so proceeding cautiously and incrementally rather than throwing everything in and hoping insight will emerge. We'll come back to this point again and again because it has both philosophical and practical implications. So why do I model? Why do I engage in this dynamic modeling? Well, one is to learn more effectively, about the world. So I can undertake actions that are effective. I can put in place the fixes that stay fixed, as Jeff McDonald likes to say. I model in terms of specifically to learn more effectively by making my assumptions shared and explicit. Within this area, we'll sometimes use more qualitative forms of modeling, or model mapping, as it's sometimes termed. This is a causal loop diagram, and it represents posited connections between change in one variable, say as stigmatization rises, what's the impact on employability? Does it tend to rise or does it tend to go down compared to the value it otherwise would have had, all of the things being equal? And these polarities you see, this negative is for this one here, this positive is for this one. As capacity for productive work goes up, employability tends to go up, for example, compared to the value it otherwise would have had, other things being equal. This is a model map. And it allows us to sort of put down in some rough way our thinking about at least the polarity of linkages here. This is a system structure diagram. Both of these are prominent in system dynamics area. This depicts feedback loops, for example. In other cases, in agent-based modeling and in system dynamics, and in fact in discrete event modeling, often we will end up using visual metaphors for our models, which people can engage with visually and build up in concrete ways. And for a lot of these models, they're intensively visual in a way that is designed to communicate with stakeholders. And we'll be exploring this in this boot camp in spades. These are AnyLogic models. In fact, they're from our agent-based model, which was used for guiding policy in 3 or 4 destinations globally. Here we have a depiction of diabetic end-stage renal disease. This built with a physician in our nephrology department, and depicting aspects of transplantation and end-stage renal disease, but again designed to be broadly accessible. And by being broadly accessible, we can use them to put down our assumptions in ways that are shared, to invite critique. Remember, a good model is a model that advances our learning. A model that identifies problems in our thinking is a success of modeling, not a failure of a model. A model that is challenged, that is falsified by showing that it doesn't correspond with empirical data that corresponds to its output, just doesn't match empirical data. That's a success of modeling because it advances our understanding. It helps us speed us towards the truth. Francis Bacon once said, truth more quickly emerges from error than from confusion. And it's kind of fail early, fail often. Try something, learn if it adds up, and if it doesn't, we've learned something either way. Yes, Michael.
How amenable are these approaches to
yeah, they are exceptionally amenable, and they are amenable in an underappreciated way. And it's a regrettable feature of the agent-based modeling landscape in literature that these contributions are not better articulated. And when I say this, I say because comparatively speaking, in the system dynamics world, for example, participatory modeling, group model building, community-based modeling, is a very strongly supported, deeply rooted in established tradition. And agent-based modeling, it hasn't had nearly that level of prominence or widespread applicability, but there are some of us pursuing it. And those of us who pursue it, I can state from our own work, find it exceptionally amenable to participatory dialogue in ways that move beyond what you can commonly do with an aggregate system dynamics model. And I particularly note a feature which some of the work Larissa has been doing, which Wade has been pursuing, and Bryce a little bit over there as well. Models as storytelling vehicles. And a key feature here agent-based models can capture aspects of context and aspects of individual history and biography, as it were, stories at the individual level that often really relate to, that people with lived experience can often relate to directly. Clinicians can often relate to them as stories of patients. They often tell stories that are compelling for thinking. And models are storytelling vehicles across all their traditions. They tell a story, but if the story is told at a level of individuals, it's often especially powerful psychologically. I'll say more than this, though, one or two other things, which is agent-based models allow us to capture aspects of context. For example, nested context that, I'm a individual in a family who's in a neighborhood and in a city that are familiar and that can be related to stories at different levels. And again, this is hard to do with an aggregate modeling tradition. It's very readily pursued in an agent-based and individual-based characterization because we can capture these levels of context that mirror levels of context in the world. Some of the models that we have built, and I have to credit Wade and Larissa and Bryce's work for it some as well, have built-in tools for storytelling that actually gather these stories of individuals in the model, agents in the model, in a way that can be interrogated or examined, or can be related to stakeholders. And if people are interested in that, we could showcase something like that.
Yeah, because I know like with SD model,
Yep.
they have that strip of Wikipedia, they have
Yep.
a lot of those resources. I haven't been able to, unless I'm looking in the wrong place, I haven't found a lot of that. Is that something you all are working on?
Yeah, it's a good question. I think what the field doesn't have yet is people who specialize in that area of methodology to the point of codifying those resources. I think a set of us practitioners, Ross Hammond, myself, I can speak to, Kurt Stange, who's applied both agent-based modeling and system dynamics, have all applied this in the context of participatory engagement. What we haven't done is sort of sought to codify and standardize and document in a publicly accessible way, these best practices and these elicitation exercises, et cetera. And I view it as partly a reflection of the far fewer number of practitioners who are in agent-based modeling in general in health, but also who are focused on kind of methodological advancement there. I think the number is small, and I'm hoping the next generation will do something like this and trying to see what we can do in our lab to make that possible. I would say I'm familiar with Scriptopedia, and I admire Peter Hoffman's efforts and the efforts of others that have gone into that. I have a healthy dialogue with Peter about these matters, and I know he's quite interested in their agent-based kind of analogs. I'd say it does need to be pursued in a way that gives a nod to the unique features of agent-based models. In other words, it's not merely potato, tomato, in terms of saying, well, we just draw this causal diagram for agent-based models this way or something. There's a different language. There's a different set of kind of considerations and possibilities with agent-based models. Their reference modes, for example, play a big role in elicitation. And with agent-based modeling, we have reference modes not only over time, but over space, over networks, et cetera. We have all these different aspects of context. The modeling vocabulary is larger, and the repertoire of what you can engage with is larger. And as a result, the kind of knowledge elicitation exercises, the scripted kind of engagements one goes through need to be broadened. And I'm hoping maybe one of my students one day this will inspire them, and we'll get something up there. But I appreciate you mentioning this as a point of interest. I will say culturally, it's one of my regrets that agent-based modeling just culturally hasn't tended, just sociologically, it's just been a different group of people who haven't tended to engage as much, and it needs to. We desperately need it across all of modeling, this sort of participatory engagement and bringing in people with lived experience. I'll say that. I do have slides in this. It is an area I could give, talk if there were of interest. We have sought to adapt modeling languages like closed loop diagramming for agent-based modeling. I think also start to provide tools that will ease that. And yeah, I have some articulated thoughts on it. I could comment. Yeah, okay, sure. So we've talked about, look, taking models and putting them in this form invites critique. I said it was the success of modeling that we can invite critique of a model like this. It's not a failure of the model if it's proven off base. It's something we discovered we wouldn't have discovered without the model. And as such, it's a success of modeling. Putting down our knowledge in a form that's explicit, putting down our theories, taking them out of our head and where they've circulated in inchoate form often, and putting them down in this sort of visually accessible form, whatever the semiotics of it that you choose, it allows them to be examined by others. It allows them to be challenged. It allows them to be critiqued. It allows them to be collectively refined. And that's a huge step forward. Just that's modeling. Just take it out of our heads, putting it out in the clear light of day and evolving it. That's a contribution. But what's going on with simulation modeling is more than that. What's going on with agent-based modeling? More than that. It's about making these assumptions precise and testable. What I mean by that is we put them in a form that's precise enough. That doesn't mean accurate enough always. Precise enough. They are specifically made explicit enough that we can run them. We saw that this morning. We had this model that depicted some rules for dynamics of weight and decision-making about food eating and procurement of food from supermarkets, convenience store. And we could run it and we could see implications of it. So, here, the model serves not as a crystal ball. It's not some, truth embodying orb. It is more like a learning prosthesis, as Jeff McDonald likes to tell. And this will sound a little bit strange, but again, bear me out with this. The idea is that, traditionally, if we think about prostheses, we probably think about crutches and canes and boots that we wear when we broke our foot or artificial legs. These are tools that allow us to achieve nearly full functionality despite our physical limitations, right? We've lost a leg, but if we have an artificial leg, we can still do many things that we would have otherwise done with this artificial leg. And so it is with crutches. We can still catch the bus. We can still get in for class, whatever. That's what prostheses do. They help us overcome our limitations and achieve near full function despite those natural limitations. And I would say modeling and simulation are cognitive prostheses. They help us achieve nearly full capabilities, thinking through the implications of our theories despite our limitations. They can help us check, do our theories line up with evidence across many different areas? They help us take our theories and check in the clear light of day, do they hold up against evidence? Are they consistent with evidence? And that allows us to think through our theories more consistently and check more quickly and thoroughly. Are they consistent with empirical data? And advance our understanding. So the idea here is, with modeling, before we had this challenge of trying to figure out if our theories in our head really are consistent with what we see empirically. I'm not sure, is that greater number of STI cases we're discovering because we're beating the bushes and finding people, or is it because of an incipient crisis and the spread of chlamydia and gonorrhea? Now we have a dynamic model that allows us to take theory and say, what will be the implications if this were true, and see if it aligns with the data. And as I said, it's, the idea here is it's better to be transiently wrong, put a model forward, find it just doesn't hold water, and advance our understanding than to be perpetually confused. It's a matter of fail early, fail often, fail forward, learn by trying something that puts it out there in a model form and learn. So why do we model? Because we all make decisions, is the truth, also based on mental models. The only question is, are they explicit? Are they in our head, or are they explicit and precise enough that we can test their consistency? And with mental models, it's hard to have others critique, to see them enough to critique them, hard to share them, hard to advance them collectively. But here with computational models, we can challenge our mental models by capturing them in a computational form, running them, seeing if they hold water, and refining them, and sometimes taking action based on them, seeing if that yields results consistent. I think I'll try to finish up here, but I will say that models also provide us a formidable tool for understanding what's going on in the world, providing us sort of this picture of what's happening out there in the world across many areas. Some we can observe and some we can't. And once we secure conviction in models, of course, once we believe that they have some grounded basis, we can assess the trade-off between interventions. And here we're addressing this double challenge we had identified before, where we have some theory about what's going on in the world. We have interventions, and we want to achieve desired outcomes. And we want to understand which interventions or intervention portfolios would best achieve the desired outcomes. Doing that in our head is hard. Doing that only informally is very difficult. Doing it with models, well, we can plug in these alternative assumptions in the model and see their implications. Performing this requires humility for a modeler, and there are certain spheres where the model may not be suitable. We can go through a hierarchy of different types of questions we can ask. Fairly easily, we can address things like which type of intervention will yield the fastest effect, will yield the largest general type of effect. Will it yield net gain or loss is often something we can try to address. But successively more difficult to ask questions, for example, what magnitude, or what level of change is like to be secured? Which one is going to be better between intervention A, intervention B, in terms of a certain number of percentage point differences? Or given an intervention, what values are likely to obtain day by day by day over time? These are harder questions. And indeed, in the opening days of the pandemic, we shaped policy in our lab just by presenting some broad outcomes, teaching broad principles, for our Ministry of Health and our health authority about the impacts of intervening at different times. Intervening later, for example, will mean that an outbreak peak will likely peak earlier, and therefore cause more cause more rush to respond. It will require faster action to respond. So intervening earlier will push off exactly when the peak will hit, so we can take more time to prepare, et cetera. Another use for models is, to anticipate what's coming. And some of you will recognize this from my systems data science boot camp for techniques that particularly bring in machine learning and dynamic models. And, at the end of the day, why do I model? Because it's the least bad of the alternatives. I go back to Winston Churchill's quote about democracy. You may have heard it. Winston Churchill once said, "Democracy is the worst of all forms of government, except for everything else." And modeling is the worst. It's the worst thing we can do to help us plan, help us make decisions, except for anything else. I am drawn back to the story of King Canute. King Canute is actually a very savvy, wise king in medieval Britain, the legends goes. But he had a bunch of yes men as advisors, and unfortunately, in those days, it was probably overwhelmingly men. And these yes men were pleased to tell him, that his power was unlimited. And he challenged it. And he said, "Look, there's some things that are beyond my power." And he said, "No, great sire. Everything is within your power." He said, "Look, I can't order back the tide." He said, "Yes, you can. The tide will obey your command." So he went to the beach and demonstrated that he couldn't, the tide wouldn't listen to him. If we want to work within the order of things, we need to understand how the world works so that we can figure out where to put our efforts to really make a difference and where it won't make one whit of difference, like King Canute with the tide. We have to understand the nature of things, and modeling helps us do that. It helps us capture more effectively over time as our learning advances the way things are in the world. So, a couple of key take-home messages from this. So addressing many practical challenges in health is hard because they exhibit features of complex systems. Dynamic modeling provides us these tools to reason about the behavior of complex systems. It does so by allowing us to posit dynamic hypotheses about how these systems work. And those hypotheses are not necessarily correct, but it's the fact that we can phrase them and ask if they are consistent with what's observed by the world, consistent with the evidence, consistent with the lived experience of stakeholders. That's what allows us to more quickly throw out hypotheses that just don't cut it, that just don't add up, to be consistent with the evidence. And as such, it helps us address these two key areas of questions. Understand what's going on in the world, explain these troubling patterns that we see, these horrible imbalances in the degree of care that's available across socioeconomic groups, or the very high burdens of illness in certain communities. It helps us understand what's driving that, and helps us understand what interventions might affect things for the better. Now, models are specific to purpose, like maps. You may recall what details they leave out depends on their purpose. And this is going to serve as a logical knife, as John Sterman likes to put it, to cut away unnecessary complexity in our agent-based models. We need that knife more than ever in agent-based models. We need the scalpel to excise unnecessary pieces, because it's so easy to put them in ways that don't build our insights. And multiple and hybrid modeling types are complementary for describing complex decision-making challenges. Models have strong limitations, but for many problems, they're the least bad of the known alternatives. So that was some components on why I model. Maybe I'll stop and just ask any questions on that before I dive into very specifically agent-based models and the features of agent-based models that recommend them for this. Questions people would like to ask? Okay, I see some earlier questions. Anyone else want to put forward questions? Okay, so let's see, online, anyone? No one? Oh, man. Okay, so like to see if we could dive into to a discussion of agent-based modeling in particular, okay? And we're going to come back to the issue of other types of dynamic modeling. But I want to get us exposed to the particulars of agent-based modeling so we can start to dive into creating some agent-based models this afternoon with some grounded understanding conceptually of what we're doing. Okay, so I'm going to